Hi, I'm Dr. Evan Phua, the owner and dentist at Kena Dental Surgery. We provide general dentistry as well as dental sleep medicine. Dental sleep medicine is an area of dental practice that focuses the use of oral appliance therapy to treat sleep disordered breathing, mainly snoring and obstructive sleep apnea. When you sleep, the muscles of your throat relax, your tongue falls backward, and your throat becomes narrow and floppy. As you breathe, the walls of the throat begin to vibrate. These vibrations produces the characteristic sound of snoring. The more narrow your airway becomes, the greater the vibration and the louder your snoring. Sometimes, the walls of the throat collapse completely that it becomes totally blocked, creating a condition called apnea, where your breathing pauses or stops. With obstructive sleep apnea, the patient stops breathing for at least 10 seconds or up to a minute. But the body attempts to breathe. The patient may actually grind their teeth or shift their jaw in an attempt to breathe. This interrupted breathing is followed by short awakening, disturbing the sleep. Often the bed partner hears the patient gasping or choking as he or she resumes breathing. As a result of repeated breathing pauses, the blood oxygen levels reduce. This causes your blood pressure to increase, straining your cardiovascular system. Therefore, it increases the risk of high blood pressure, heart attack, and stroke. If you have been diagnosed with obstructive sleep apnea, you would probably be prescribed with a CPAP machine such as this. CPAP machine is no doubt the gold standard for the treatment of obstructive sleep apnea. As a dentist, we truly acknowledge that. But one thing is for sure is that in order for CPAP treatment to be successful, you have to be compliant to the treatment, which means that you have to put on the CPAP machine every night when you're asleep. Unfortunately, not everyone is able to accept or tolerate such treatment. If you happen to be unable to tolerate a CPAP machine and you would prefer an alternative, perhaps an oral appliance would be your answer. The oral appliance that we use to treat obstructive sleep apnea is custom made according to your jaw. They are also known as the mandibular advancement splint, which means that it helps to push your lower jaw forward. And as your lower jaw is being pushed forward, your tongue is being pushed forward. With your tongue being pushed forward, your airway is being opened up, which allows a more effective breathing and unrestricted breathing during sleep.